So let's have you guys, having spoken about the direct acting sympathomimetic drugs, which we said that this type of sympathomimetic drugs, they actually have like a direct effect on the beta and the alpha receptors of the sympathetic nervous system. We're going on to talk about the indirect acting sympathomimetic drugs. And let me just give you guys a word on this. Basically, the indirect acting sympathomimetic drugs, they are not acting directly on the beta and alpha receptors, but they are making sure that the neurotransmitters of the sympathetic nervous system are in excess or in sufficient amount. Do you understand? And their mode of action could be that they are triggering the release of more neurotransmitters, or it could be that when these neurotransmitters are released into the synaptic clefts, these drugs will act to prevent their destruction or reuptake. Do you understand? Those are the indirect acting sympathomimetic drugs. So we'll be looking at in depth in their mode of action, and I've already spoken about the mode of action, then also the examples. All right. So looking at this now, we said that sympathomimetic drugs as a whole are drugs that mimic the stimulation of the sympathetic nervous system. They are classified as what directly acting, which they act directly on alpha or beta receptors. We have already spoken about them. We have indirect acting, they act by providing more norepinephrine to act on the alpha and beta receptors. Then also we have the mixed acting, which they act by what both mechanisms. Okay. So indirect acting sympathomimetic drugs are compounds that release noradrenaline from adrenergic stores. They don't act directly. Okay. They don't directly interact with receptors, but instead they enhance the release of endogenous catecholamines like what norepinephrine, also known as what noradrenaline, and epinephrine, also known as what adrenaline. And another mode of action, it could be that they prevent the reuptake of these neurotransmitters after they are done eliciting their action on the nearby nerve. They need to be destroyed or taken up again. So basically, it will increase the longevity of these neurotransmitters at the synaptic cleft. Okay, so that's the two mode of action. So indirect acting sympathomimetic drugs now. Let's talk about the examples now. We've spoken extensively on the mode of action, two mode of action. Now, we have what amphetamine. This is a well indirect acting sympathomimetic drugs. Amphetamine increases the release of what norepinephrine and dopamine. All right. So now it is used for various purposes, including what treating attention deficit hyperactivity disorder, that's the ADHD, and narcolepsy. Okay. Then we have another type of drug that falls under this category, and this is what the methylphenidate. And this is another commonly used drug. The methylphenidate, often sold under the brand names like what Ritalin, also enhances what norepinephrine and dopamine were released. It is primarily prescribed for what attention deficit hyperactivity disorder. Okay, we have other examples too. We have Ephedrine. Ephedrine acts as a direct and indirect sympathomimetic, right? So it's a mixed action, but we can still discuss it under the indirect. Okay, so now talking about it under the indirect, now we're talking about its indirect action. So it stimulates the release of what norepinephrine and also directs what also directly activate adrenergic receptors. Historically, it was used for asthma and nasal congestion, but its use has declined due to safety concerns. Okay, then we have beta agonists. We said that these drugs, such as what albuterol, are used to treat bronchospasm, nasal congestion, and allergic disorders. They indirectly enhance norepinephrine release. Then we have cocaine. Although not a therapeutic drug, cocaine inhibits the reuptake of norepinephrine, okay, and other neurotransmitters, and this will lead to what increased levels of what endogenous catecholamines, leading to what sustained excitation. Okay, so guys, that's it about talking about indirect acting sympathomimetics, basically looking at a mode of action and examples of drugs under this category. All right, so bye for now, guys.